aspirin-like drugs are working in a completely different way. They're not working in the brain. They're working out in the periphery.
What's the periphery?
Oh, yeah, exactly. Sorry. The periphery is everything that isn't the brain and the spinal cord. So that, they work out in the body. So if your foot hurts and you take an aspirin, it's going to work in your foot, right? Whereas if your foot hurts and you take morphine, it's going to work in your brain. And those drugs work a completely different way by blocking a particular enzyme. So, all the analgesics we have ways that they work that we understand. The curious exception is Tylenol. We have no idea in 2023 how Tylenol works. There are a bunch of theories, but there's no solid evidence for any of them.
Mean by we don't know how it works?
The other drugs, we know in excruciating detail that they act on this type of receptor precisely there, and by doing that, block this signal that's going from here to there, eventually up to higher parts of your brain where pain is perceived. For Tylenol, we don't even know what receptor the drug is blocking. Even the very first step is not clear.
Even in animal models as well?
Even in animal models. And again, that's not to say there aren't some hypotheses on the table with some data, but that's all they are at this point, hypotheses. And they're competing hypotheses, so different groups have completely different explanations of what they think that this drug is doing. And I just find it curious for a drug that's so old
and popular
that we can't explain it like we can all the other ones.
What's the most convincing hypothesis for you?
I read a serotonin hypothesis that seemed pretty convincing, but things are upended all the time. There was just, for example, a very celebrated paper that came out a few days ago that the psychedelic drugs, which we have thought for decades worked on serotonin receptors.
What are the psychedelic drugs? Because that's quite a big branch.
Yeah, ayahuasca and LSD, psilocybin, that whole class. Evidence came out just a few days ago that these drugs are all very convincing evidence that these drugs are working by binding to a receptor called TrkB. And again,
what is TrkB?
Yeah, it's a receptor for a neurochemical called brain-derived neurotrophic factor. And again, does it matter, serotonin, TrkB? But the point is that the entire field, for decades were convinced and looking in one place, and then knew, but it never really completely cohered. And then all of a sudden, very convincing data comes out and says, you know what, it's not those receptors at all, it's this receptor. So things change, right? Eventually people figure things out. It just sometimes takes a while.
And what, just not to focus too hard on the psychedelics, but what methods did they use to find out it's TrkB that's being signaled onto?
This paper was in Cell, so they used every method.
Okay.
Basically every way you could do it, they did.
Okay.
So there was electrophysiology, and there was neurochemistry, and there was pharmacology, and there was optogenetics. It was very modern and convincing story.
So besides opiates, which is kind of like a traditional pain medicine, are there non-traditional pain medicines coming to fruition?
Well, I guess the big one there, of course, is the cannabinoids. It's starting, obviously this is something that was hyped in a very big way. People were very excited about that. The early evidence suggests that they work very well. I personally have a feeling that what is eventually going to be discovered about the cannabinoids, it's exactly what was discovered about the opioids, which is that they probably work very effectively for acute pain for a certain period of time. And the more you take it, the longer you take it, the less it works, till at some point it doesn't work at all, statistically versus placebo.
Okay.
I think that's basically the situation with the opioids now, and more the meta-analyses of cannabinoids for chronic pain show that they don't work. They probably do work for acute pain. And if something works for acute pain, it probably sets up a very strong placebo response in people, such that when time passes, it's harder and harder to let go of the idea that this thing might not be working anymore because it definitely used to work, right? So there's a lot of conditioning that happened that now has to be extinguished, and it takes a while to extinguish conditioning. Conditioning is very powerful.